I became a statistic today, a mortality statistic. No, it wasn't a car accident or a stroke. It happened right here in the hospital. Inexperience killed me. And it wasn't the wrong medication or a botched procedure. I was the victim of faulty delegation. The mistake had nothing to do with poor technique, but it was lethal nonetheless.
Delegation, done effectively, is one of the most powerful tools a nurse can use. But faulty delegation can spell disaster for the nurse, the client, and the employer. Welcome to our program, Delegating Effectively, working through and with assistive personnel. This is the third in our series on professional challenges, and it explores the vital role of delegation in today's healthcare environment. In this video, we'll follow the story of Mrs. Campbell. As her story unfolds, you'll get a first-hand look at how critical the skill of delegation can be. Throughout the story, a red flag will appear on the screen when an important step in the delegation process has been breached. Then, Vicki Sheets, a nurse attorney and director of practice and regulation for the National Council of State Boards of Nursing, will comment on where the problem occurred and why. Delegation is a double-edged sword. While you can accomplish much more working through others than you can do alone, there are some inherent risks and liabilities whenever you delegate. Preparation is the best prevention, and yet many nurses today still do not feel adequately prepared to delegate.
My assessment of new graduates' ability to use delegation is that it's poor. It's not a strong component of nursing education, and it sometimes is a difficult tool for them to be able to do, especially in the initial probably first 6 months. The problem is the disconnect between the theory and the actual practice, the ability to use the theory in their clinical rotations as they spend time as a student before they actually become the graduate nurse or the nurse.
Delegation is the process of transferring to a competent individual the authority to perform specific nursing tasks in a specific situation. These assisted personnel are usually unlicensed staff members. In most states, they're listed on a registry. In some states, they're certified, and in only a few states, they're licensed. These helpers may be referred to as nursing assistants, nursing aides, or patient care technicians, but regardless of the title, they're not nurses and are not authorized to practice nursing. Their authority to perform nursing tasks comes from the licensed nurse through the process of delegation. Delegation is built on mutual trust and respect. Each party is dependent on the other. The nurse depends on the assistant's skills in performing the assigned task, and the assistant depends on the nurse's availability and guidance. It is a symbiotic relationship.
We can't do our job without them, and they can't do their job without us. We are their eyes, ears for the patient.
Nurses don't own delegation. It is a universal process used in the business world. But because of the critical nature of nursing practice, delegation in nursing is addressed in most nurse practice acts. Delegation in nursing is a legal as well as a managerial act.
Delegation is a skill, and like any skill, in order to become proficient, you have to practice. It may come easy to some, and others may struggle with it. Unfortunately, many nurses are thrust into the role of delegator without adequate preparation and experience.
As a nursing student, you actually do everything yourself. You're taught to get one or two patients. Not only do you give the medications, but you do the complete care of that patient. So you don't really have to delegate to your ancillary staff.